Good evening, everyone. Thank you all so much for joining us. We are going to give it a couple more minutes. We'll get started a little bit after 6. We're going to let people continue to join. But while y'all do so, if you will go ahead and fill out that poll that is on your screen, it's anonymous, but we would love for you to answer that while you wait. And we will get started just a little bit after 6. Thank you so much. Hey everyone, thank you all so much for joining us. We're going to give it a few more minutes. If you're new to joining, if you will go ahead and answer that poll that is on your screen, it is anonymous. We will get started a couple minutes after 6, but just fill that out while you wait. Thank you so much. Hey everyone, I know it's 6 o'clock. We're going to give it 2 more minutes and then we'll get started. Just go ahead and fill out that poll that's on your screen while you wait, and we will start in 2 minutes. Thank you. All right, everyone, we are going to go ahead and get started. Good evening. My name is Marianne, and I work for Medtronic. Tonight, I have the pleasure of hosting this webinar where you are going to get to hear from Dr. Proctor with Georgia Urology. Dr. Proctor completed his undergraduate degree at the University of California at Irvine, where he also received his Master of Science in Molecular Biology and Biochemistry. He then graduated from New York Medical College, where he received the Sprague-Carlton Award for Proficiency in Urology. He completed both his internship and his residency at New York Medical College, and he served as the lieutenant commander in the Navy at the Naval Hospital in Pensacola, where he was the chief of urology. Tonight, he is going to be speaking on overactive bladder, urinary retention, and fecal incontinence or stool leakage, as well as a therapy called InterStim that helps to treat those. As I mentioned, I work for Medtronic, and that's the company that developed this therapy. While you may not know the name Medtronic, you probably do know someone who's had a pacemaker, and that is what we're best known for. So in a minute, I'm going to pass the mic to Dr. Proctor so that you can hear more about all of this. But before I do that, I just want to make a couple of reminders. Everyone was muted upon entry. If you have a question, please type that into the Q&A box that's at the lower portion of your screen. And then the chat has been disabled. So if you have any questions, like I said, please type those in the bottom portion of your screen. Go ahead and answer that poll that's on your screen right now if you have not. And then we are going to get to your questions at the end of the presentation. So without further ado, allow me to welcome Dr. Proctor.
Good evening, everybody. Thank you so much, Marianne and Medtronic, for setting up this webinar for us. And thank you, everybody, for joining. So I'm Dr. Jeffrey Proctor. I'm with Georgia Urology. For Georgia Urology, I'm the head of overactive bladder and interstitial cystitis. And Medtronic has made me a center of excellence for neuromodulation, sacral neuromodulation, which we'll get to in a little bit. So let's see. Marianne, my slide's not advancing.
Let me see if you can click next, Dr. Proctor, on the bottom.
There we go.
There we go.
All right, so everybody can read through this, but everybody, I guess most people that have joined have a lot of urinary or bowel problems. They're always thinking, can I go to certain events? Can I leave the house? Or they map bathrooms. They know going to the mall, what bathroom there is at each end of the mall. They worry about wearing white pants. It's time for a change. We can help you with that, and we'll talk about that. But studies have shown 50% of people with incontinence haven't even talked about it with their doctor, and 44% of people are embarrassed to even talk about it with their doctor. So if we can't talk about our bladder or bowel control issues, we can't help you. So by coming to this webinar, that's a good first step. So a lot of people believe as they get older, bladder and bowel issues are inevitable or part of life. They're not. So you don't have to necessarily void more than 8 times a day or have that urgency or that feeling that you have to go now and do that pee dance. Again, bathroom mapping, planning where you're going to the bathroom all over the mall and all over the place, getting pads, getting up at night. This can be quite disruptive to your lifestyle, to your emotion. It causes a lot of emotional stress. So your body is telling you something. So let's take control of that. We can help you with these symptoms. You can get control of your life back. You can enjoy your grandkids or go to a ball game, baseball season, go to a baseball game or go to a movie. So there's a lot we can do with this. And believe it or not, you're not alone. A lot of people, not only do they not want to talk about it with their doctor, they don't want to talk about it with other people. But incontinence affects peoples of all age. There's a higher proportion with each decade in life. But again, ignoring bladder and bowel control problems can lead to more issues, loss of confidence and self-esteem, loss of sleep, which can greatly affect your health. Studies have shown 1 in 6 adults in America have bladder control issues. That's 43 million adults. That's more prevalent than diabetes and eye conditions. 1 in 12 adults, or 21.4 million, have bowel control issues. So you're not alone. there's a lot of people that have these diseases. The good news is there's treatments that we can get your bladder and bowel control back. So you have more freedom. You can enjoy life, feel like you have control, and move around more. So what causes bladder and bowel control problems? We're going to go through a lot of things, but a lot of it's daily habits, what you eat and drink. The more spicy foods, alcohol, sodas, caffeine, that can cause more irritation in the bladder and more frequent urination and urgency. Some medications, especially diuretics or supplements, can affect your bowel and bladder control symptoms. Especially in the women, pregnancy, childbirth, can cause injury to the pelvic floor, and that can cause conditions that affect the bowel and bladder control. I don't know if they need to scan that. I'm going to move on. If anybody wants to scan it, I guess scan now.
That is the appointment scheduling portal right there. So if you want to go ahead and make an appointment, you're welcome to scan that now. And then when you're prompted for the reason for your visit, you will put webinar in where it says that, but we will also cover that at the end. So no pressure to do that now, but that's what that QR code is.
Should I give a minute or move on?
You can go ahead and move on. It's more at the end as well. So you're good.
So this is a fancy slide, but we'll talk you through it. So how does the bladder work? There's a communication between the bladder and the brain, and then the brain back to the bladder. And so there's a bladder-brain communication, and with overactive bladder or overactive bowel, there's a communication breakdown. I'll age myself, but that was an old song called Communication Breakdown. But anyways, basically with the bladder starts getting full with urine. When it's half full, it says a signal to the brain that says, hey, I'm getting full. So the bladder sends a signal to the brain to empty the bladder. So with overactive bladder, that gets a little haywire. It gets more sensitive. So the bladder is less full, and it's already sending signals to the brain that, oh, I got to go to the bathroom. And then the nerves that back to the bladder says, oh, you better go to the bathroom now, and you better go now. Think of it just to make it more simplistic. Babies, they're in diapers, their bladder gets a little full, and then the brain tells the bladder just to void. And then they get toilet trained, late 2s, 3s, sometimes age 4, once they get more of the brain control to the bladder. So it's the nerves going haywire that leads to the overactive bladder. So unlike regular conventional treatments, the Medtronic bladder control therapy gently stimulates the sacral nerves in your pelvic area that controls your bladder. So we'll talk more about that in a bit. Same thing with bowel control. The digestive system pushes food through the intestines. It could take 12 to 36 hours. The bowel, it's several portions, contracts, called peristalsis, so it sort of squeezes it through. When the rectum gets full, it stimulates the nerves to the brain, says, hey, brain, the rectum's full. So the brain sends a signal to relax the anal sphincter so you can have a bowel movement. So with fecal incontinence, there is, again, a communication breakdown that can cause the bowel control symptoms. So the 3 types of bladder control problems, and we'll talk about all of them: stress incontinence, urinary retention, and overactive bladder. Stress incontinence, that's when you leak, when you cough, sneeze, laugh, not like stress, you're having a bad day at work, but stress on the bladder. So if you exercise, bend, jump, run, you leak urine. So we'll talk more about treatments for that, but that's more try Kegel exercises, and a lot of times that's surgery. But the InterStim neuromodulation system does not benefit stress incontinence if it's pure stress incontinence or stress is the major component. Urinary tension, that's when the person is not emptying the bladder. Some people can't tell that the bladder is full, but they might be urinating all the time because like their bladder is like 80% full. So it doesn't take much for them to start leaking or having a dribbling stream. It can be very frustrating because these folks need to have a catheter or to catheterize themselves multiple times a day. So with unobstructive urinary retention, the InterStim sacral neuromodulation system can benefit. There's also obstructive urinary retention where the system won't work. It's not indicated. Next is overactive bladder. Overactive bladder in a nutshell is urinary frequency, urgency, and urge incontinence. So what does that mean? Frequency is voiding more than 8 times a day or 2 or more times at night. Urgency is when you have that feeling like if I don't go to the bathroom now, I'm not going to make it. And a lot of people, the closer you get to the bathroom, the urge gets worse and they leak urine. And getting up at night, or nocturia as we call it, 2 or more times. You know, a lot of people do different things. They limit the amount of fluids because they know the more they drink, the more they're going to urinate, the more they might leak urine. They use protective garments, the pens or pads. They wear dark clothes. Again, they bathroom map. They feel like the bathrooms, they're not completely emptying their bladder even after they go to the bathroom. So that's overactive bladder. Fecal incontinence. This is a recurring condition where you leak feces prior to making it to the bathroom. You're unable to resist the urge to go. Or passive incontinence. You don't feel it when you're going, but then you might notice a leakage in your underwear. Again, people plan activities around the bathroom. They don't want to go too far away from the bathroom. It stains underpants, and they use protective pads and protective clothes again. So there's a lot of ways to control these symptoms, starting from conservative lifestyle changes. Next is oral medications, and then the more advanced therapies. We're going to talk about all 3 of these different areas. So first is lifestyle changes. Again, we touched on diet a little while ago, but the more fluids you drink, the more you're going to urinate. I have patients that drink 3 to 4 liters a day. Obviously, you're going to urinate more frequently. The more sodas, caffeine, bladder irritants, spicy foods, alcohol, the more you're going to urinate. Exercise, exercise can help if you lose weight. Sometimes that can help with some of the incontinence issues. Biofeedback and bowel retraining. So for the bladder, let's say you have to urinate every 2 hours. Then you try and say, all right, I'm going to try and wait 2 hours and 5 minutes or 2 hours and 10 minutes, and slowly try and retrain your brain that you can last a little bit longer. You can also go to a physical therapist for biofeedback training. And then there's pelvic floor strengthening or Kegel exercises. Imagine squeezing the pelvic muscles, not when you're urinating, but the muscles you're going to use to stop your urine. If somebody walks in the bathroom, you're urinating and you want to stop the urine midstream. So don't do it while you're urinating, but squeeze those muscles for a count of 8. Relax. Do a set at 8 and do a couple sets a day. That's Kegel exercises. Next step up the ladder, getting more aggressive, is oral medications for bladder control. These medications must be taken daily. A lot of them, the anticholinergics, can have more side effects than the newer beta stimulating medications, but they can cause dry mouth, blurred vision, hypertension, constipation. In one survey, 72% of people said they stopped taking their bladder medications within 6 months. There's been a lot of recent studies lately that patients, people 70 years old or older, can be very sensitive to the anticholinergic class of medications. It can cause confusions and a lot of other problems, as well as, like I said, dry eyes and and constipation. So some people say if you're over 70, you should not even start on the anticholinergic class of medications. So what are the patient satisfaction rates, or more appropriate dissatisfaction rates with oral medications and OAB treatments? Only 20% of overactive bladder patients are extremely satisfied with their current treatment. 82% of overactive bladder patients are non-adherent at medications at 12 months. So only 18% stay on medication after a year. That's a huge number. In a lot of practices, patients don't even come back to see their urologist or their doctor. 60% of patients do not return after their initial appointment, 80% after the second appointment, and 90% do not return after their third appointment. We can't help you if we can't get you back. So we need to help you get back and do different things so we can keep you back and keep you engaged and know that we have a treatment plan. So I try and tell my patients up front, we have a treatment plan that we're going to adhere to get them better, try and get them better.
And Dr. Proctor, you can touch too on that last slide about y'all's nurse navigation program, because I think that's a really great thing for getting people to come back to the practice.
So thank you. That's a good point. So I started I started the overactive bladder protocol for Georgia Urology. In that protocol, we have nurse navigators that are outside like consultants. And so we have them sign up and call the patients and see how they're doing on the medications. And a lot of these protocols, you have to fail 2 medications before you have what we call third line therapy. First line therapy is the conservative therapy. Second line therapy is a medication. And we're going to talk about third line therapies in a second. But the nurse navigators also will answer your questions. Make sure you have appointments. If there's any questions about any line of therapy, they'll help you with all third line therapies or the medications. And practices that have nurse navigators greatly increase the amount of follow-up visits and the amount of people that stick with it. So our dropout rate after first appointment was 60%. I think we're down to 25%. So it greatly enhances. So thank you for bringing that up, Marianne. So now third line therapies for bladder and bowel control, Botox for bladder control, posterior tibial nerve modulation, PTM, and InterStim. So we're talking about each of these separately. So medications work on the bladder muscle, not the nerve. Botox, you look inside the bladder, inject the Botox directly into the bladder muscle and relaxes the muscle. So you don't have that as much frequency, urgency, or urge incontinence. The effectiveness is comparable to oral medication. It doesn't address the bladder-brain communication. The average for overactive bladder in the studies is you need to repeat the Botox injection every 6 months. Side effects, about 6% can have infection. Studies show about 6% have temporary urinary retention where you have to self-catheterize or have a Foley catheter in. So that's bladder Botox. One study, this is a little high, but one study showed up to 67% of patients discontinued treatment after their first Botox injection. But there is a high dropout rate even after the first injection for Botox. Next is posterior tibial neuromodulation, or PTNM, the Medtronic neurosystem. The posterior tibial nerve lies on your inner ankle, right below that medial malleolus, that little bump at the bottom of the ankle. So you gently stimulate that nerve, and it's been shown to reduce overactive bladder symptoms of frequency, urgency, and urge incontinence. It's thought to normalize control of the bladder's natural reflexes. So they come in the office, you can read a book, talk to your family member, but the stimulation's for 30 minutes in the office weekly for 12 weeks, and then monthly maintenance for long-term relief. So that's posterior tibial neuromodulation, or PTNM. Next is sacral neuromodulation, or SNM, sacral neuromodulation, the Medtronic InterStim system. So this is a gentle stimulation to the sacral nerves. So you're disrupting the communication pathway between the brain and the bladder or bowel, and restores the bladder or bowel function. This system is more effective than medication. And we start off with a simple test. I usually do it for a week, and the test will see if you have good improvement of symptoms or not. And then if you decide with your doctor to move forward, then a small implant is made just below the skin and in the upper buttock to implant the devices. They have two batteries. They have a recharge-free and rechargeable device. So looking at the two hands, as you're looking at the picture, the right hand, the right side, it's actually the doctor's left hand, but the right side, you see the battery is a little bit bigger. That's the non-rechargeable battery, and it lasts 10 to 15 years. It's a new generation bladder. The one on the left side of the screen is the rechargeable battery. You have to recharge it every week or two. It's smaller, so a smaller incision, and that lasts also 10 to 15 years. And these are full body MRI compatible. So you can have an MRI anywhere in the body. So you can take back control. And again, it's a simple test. So you'll know if the system will work. They've had over 375,000 people worldwide have had this therapy. I started doing this therapy in 2000. So I have been doing, I think, the longest in Georgia. So usually we do it in my ambulatory surgery center, outpatient under local anesthesia. There's a thin wire that we put in on the right and left side of the upper buttock to place next to stimulate the nerves that go to the bladder, and you record your daily symptoms. The way I look at it, and I should have talked about this with the slide with the nerves, but think I call this a bladder pacemaker. They used to not to like to make that analogy, but a heart, if it's beating too fast, so the nerves are stimulating the heart to beat too fast or too slow, a heart pacemaker makes it more regular rate. The same thing applies to the InterStim. Think of it as a bladder pacemaker. We're stimulating the nerves, and if they're too fast or too slow, we're trying to make it more of a regular rate of voiding. So, and over 80% have achieved success with improvement of symptoms at 5 years. So after a week, I have the person come back to my office and remove the leads. We review their daily symptom scores. And if there is 50% or more improvement of symptoms, then that person would be a candidate to go to the operating room to implant the device that we just talked about, if they want to proceed. So is this therapy right for you? So people that have tried conservative therapies, diet, Kegel exercises, and failed that, they've tried oral medications. Most insurances want you to try and fail 2 oral medications before you move on to third-line therapies. And you have moderate to severe symptoms. Now, what's moderate for one person may be mild or severe for another person, but if it's moderate or severe symptoms, then you should seek treatment to have third-line therapies or InterStim to help control these symptoms. So it's been proven effective. 84% of patients have InterStim have had significant improvement in bladder control, which is 3 times better the quality of life compared to medication. It's the only treatment that's more effective than medication. And 89% of people using Medtronic bowel control therapy experienced long-term success. So for fecal incontinence. So it's highly successful for both overactive bladder and fecal incontinence. So that's my presentation. We're happy to answer all your questions, and I greatly appreciate you joining us tonight. So I think
we're going to go ahead and get to the questions. And I want to make a quick announcement. I know we discussed this briefly earlier, but there is a QR code that is on the screen right now under where it says make an appointment today. That is going to be the fastest way to get in with Dr. Proctor to make an appointment. So if you will scan that with your compatible device, whether it's an iPhone, Android, just open up the camera. You will scan that QR code and a little yellow banner will pop up at the bottom for you to click on. When you click on that, it will take you to the scheduling portal. And when you're prompted for the reason for your visit, please type in webinar. That will be the easiest way for you to get a quick appointment with him. And you can also do this if you are on your phone right now and you can't scan a QR code. You can go to the scheduling portal on the website. So gaurology.com. There's a schedule button and that's orange in the corner. And if you click on that, you can do the same thing with Dr. Proctor where you type in webinar as the reason for your visit. So that's going to be the fastest way to make an appointment. If you have any questions about that, you can go ahead and type those in the Q&A as well. But we have a lot of questions, so we will go ahead and get started with these. The first question, Dr. Proctor, is you've helped control a lot of my IC issues already, but I'm still having to go to the bathroom a lot. Will this help me not pee as often?
absolutely yes. So I use InterStim a lot in my interstitial cystitis patients. So the medications for interstitial cystitis can help sometimes some of the frequency, urgency, and pain, but studies show that in IC patients, interstitial cystitis patients, not only does it control overactive bladder symptoms, but 55% of the time it controls pain. Now, it's not indicated for pain, but that's a positive, side effect that not only can we help interstitial cystitis patient with the overactive bladder symptoms, their frequency symptoms, but it can also help with the pain.
All right. Our second question is this therapy recommended for someone that has had their prostate removed due to prostate cancer?
Yes, I've done that. I've done InterStim in this situation. Some men have had large prostates that lead to a very thickened bladder that can't distend as well, hold as much urine, and has the nerve hypersensitivity or upregulation. So for overactive bladder symptoms and urgent incontinence, after having the prostate removed for prostate cancer, I've had multiple patients, I've had benefits with InterStim in that situation. So yes, that can help.
Wonderful. All right. We have another question. My wife is afraid to leave the house to go to church or dinner because she's not sure if she's going to have an accident. Will the InterStim help with that?
Yes, again, on all these questions, as we saw, the test has about an 80% success rate. And then the implants, there's 84% have long-term success rate. So when I say yes to all this, yes, there's a chance that a very high chance that this can be beneficial. I can't promise in any one person that there's going to be success, but it has a very high success rate, and it's worth trying the test for a week to see if you have improvement of symptoms.
All right. We have another one. This is a little more of a vague question. They said, are they looking to have a more permanent solution to OAB? So I am not sure if they are referencing. If you want to elaborate more on your question, I don't know if you mean if the device is a more permanent solution or if they're looking to develop one. But this, InterStim, like Dr. Proctor said, is 10 to 15 years. But I will let you elaborate more on that too, Dr. Proctor.
Yeah, I mean, depends what you mean. Permanent meaning, well, medication you got to take every day. The posterior tibial nerve stimulation after 12 weeks, you have to do monthly. They have a new implant that right now lasts about 3 to 5 years. The Medtronic sacral nerve modulation, the InterStim, especially if the non-rechargeable battery that lasts 10 to 15 years, you put it in and, you know, it's maintenance free. We probably need to see you yearly and just make sure that everything's working properly. And just like a car, I make the analogy that you do it, not that your body's a car, but a car, you do a tune-up yearly or depending on how much you drive to make sure everything's working right. We just do a look at it, make sure the programming is right. But pretty much for a lot of people, for 10 to 15 years, it has great relief of symptoms. So that's not permanent. There's nothing else right now, like a new bladder. There's nothing else that has a, it depends what you mean by permanent, but this is very good, 10 to 15 years of therapy before you have to replace the battery.
Yes. All right. So we have someone who asked, what percentage of patients do you see experiencing improvement in satisfaction with the InterStim?
I think I see a little bit higher with the new leads that we use to test it. Medtronic came out with new leads several years ago, and I think that the positive rate of success is probably closer to 85% in my experience. So that's a very high success rate for greater than 50% improvement of symptoms. Now I've had, again, that's the big caveat. I've had some people that it's baseball season, and you have grand slams, and you have some people that have doubles or home runs. You know, I've had people that have had 8 to 10 pads a day go down to 0. I've had people that have 8 pads a day that go down to 2, and then 2 years later they're frustrated with 2 pads per day. But I have to remind them what they started with. So did I answer the question, Marianne?
Yeah, and I can give just for some 5-year data too that Medtronic has done. So we have 82% of our bladder patients that are at 50% improvement or greater at 5 years, with 45% of those being completely continent. And then our bowel patients, 89% of those are 50% or greater improved at 5 years, and then 36% of those are completely continent, 36%. So that's some 5-year data for you. That's just a generalized Medtronic study data. But like Dr. Proctor said, the nice thing now too is the test leads have been modified to where they stay in place a lot better. So you get to actually sample the test for a longer amount of time, see how you do, and don't have to worry about the leads moving as much. So 100% that answered it. Okay, we have another one. I have had 2 appointments with a doctor at your Monroe office. My diagnosis is OAB, and the doctor advised me to go to Lawrenceville office once a week for 12 weeks. I can't do that. Is there a portable machine that can come to the Monroe office?
By that question, I assume that this is posterior tibial nerve stimulation. Not that I'm aware of. If you call my office, we can look into that. Again, other alternatives. I don't know, not everybody can have surgery, but there's the InterStim, sacral nerve modulation, or there is a new implant in the ankle for the posterior tibial nerve stimulation called eCoin. And I'm the only active one in my group doing that. So those are some possibilities if you can't drive all the time.
All right. Another question. If you do not need it for the bowels, does it affect you for the bladder?
Say that question again. If you don't need it for the bowels?
So if you don't have bowel control issues, will it still help your bladder symptoms?
Absolutely, yes. These are 2 separate studies. And people that have both, you can have great success in both, but it can be one or the other. And the majority of my patients I see for the InterStim is for the bladder disease, but I do see patients for bowel disease. So if it's just bladder, absolutely, this has a high chance of helping your symptoms.
All right. Someone asked how you recharge the rechargeable implant.
you have a little you have like you can put it onto a like a little belt, and you put the little recharger on it, and then it communicates, and it takes about 30 minutes um weekly. Some people do it every 2 weeks. So it's a neat little system. So usually we recommend do it the same day a week whenever you watch TV. Do you relax Sunday night and watch TV? While you're watching TV, just hook it up for a half hour or whatever day, pick whatever day works for you. But it's about half hour every 1 to 2 weeks.
Continuing off of that, how many patients do you feel like you've seen that have done the micro rechargeable one? Do you typically, like, what percentage of your patients have a rechargeable versus the InterStim X that is non-rechargeable?
No, that's a good question. When for a while there, the rechargeable battery had longer battery life. So I was implanting more, maybe 50-50 rechargeable, non-rechargeable. But now the new generation X non-rechargeable battery lasts 10 to 15 years. That's comparable to the rechargeable. So I find most people want it one and done, sort of like a basketball analogy now in March. But so you don't have to think about it. I think some very petite people, especially women who might want more tiny bikinis, may want the non-rechargeable because it's a small incision, but I'd say I'm probably 90% or more non-rechargeable right now.
All right. We had someone else ask, how much is this therapy?
Most insurance plans cover it. I can't tell you the full price. I have a central billing office staff that answers all those questions. What I can tell you with Georgia Urology in my group, what we do is we don't know what your insurance will pay until we set you up for the procedure. Once we set you up for the procedure, my staff will find out like a week or so ahead of time and let you know what the cost is to you specifically. Now, obviously, people with high deductible plans earlier in the year, you're gonna have to meet that high deductible first. So I'd have to leave that to my billing staff to answer that. I do the medicine side, I let them do the billing side, but with Georgia Urology, we don't want surprises with you. You'll know what it costs beforehand, but insurances cover it, Medicare covers it. So do you have anything to add, Marianne, about that, or?
Really, that, yeah, like you said, most insurances cover it. It just is unique to your situation as far as deductibles and the percentage that they cover. But like Dr. Proctor said, you should know in advance what you're getting into before you sign up for that. So his office will make sure that you have an idea of what you're expected to pay. We have another one about the micro. Can you tell when the battery gets low?
If you plug it in, I think you can. But you know, right, Marianne? You
There's
can
a
tell
way
there's a way. I
in
think
the
with
patient app. Yeah, there's
if
in the patient app on your, so you have like a Samsung programmer. The app that you have will show you the amount of battery that you have. Typically, if you do it once a week or once every 2 weeks, it's not going to die. And so you'll have plenty of battery. But like Dr. Proctor said, that most of our patients now, I'd say, anywhere from 95 to 97% of the people that we see are getting the non-rechargeable one because it's something that you don't have to think about. You don't have to worry about that battery getting low. And then conversely, towards the end of the battery life, if you have the non-rechargeable one, you can also check that to make sure that is a 10+ year battery. So that one lasts a while. All right, we have a couple more. Go ahead and start typing in any other questions that y'all have because we're going to start wrapping things up pretty soon. We're getting to the end of the questions. So one of them is, how many medications do I have to try and for how long until I can move on to one of the more advanced therapies?
most insurances, you have to fail 2 medications. Rarely do some insurances dictate how long you have to try the medications. In the overactive bladder program that I wrote for Georgia Urology and with the nurse navigation, I usually give a month of samples of medication, and we have follow-up in 2 months. If you fail after a month, we give you a second month of medications. So after 2 months of medication, if you fail 2 medications or you're intolerant of it, or you have side effects, dry mouth, constipation, hypertension, then obviously you stop it. So it's usually how I have written things up. It's 2 medications a month each. And then we'd have to look inside the bladder, called cystoscopy, make sure there's no lesions or anything to cause the overactive bladder. If we're doing for overactive bladder, and we may do urodynamics. But to answer your question specifically, 2 months of medication.
All right. Someone asked, I have done a 12-week session of PTNS. I have seen some relief and I was able to get off one of my 2 medications. I have had some relief, but I'm still not where I want to be. What would you recommend for next steps?
Next steps are the other third line therapies, bladder Botox, which again, you have to do every 6 months or less, or it'd be a good candidate for sacral neuromodulation with InterStim. This is directly, InterStim is directly helping the nerve between the bladder and the brain. Whereas the posterior tibial nerve is down in the ankle and it's going, think acupuncture, but it's affecting the nerves to the bladder in a retrograde fashion. But InterStim is the only one that's connecting, doing something to the nerves, help regulating the nerves between the bladder and the brain. So if you're not getting the success rate that you'd like, I'd suggest InterStim.
All right, we have another question. I currently am receiving Botox. Do you have to wait for the Botox to wear off before trialing this therapy?
Yes. In the old days, they used to have to say wait 6 months, but if we have to show with the test of InterStim that you have 50% improvement of symptoms. So let's say you were leaking 4 times a day and you did Botox and now you had some improvement and now you're leaking 2 times a day. Well, we have to go down to 1 or 0. That might be a little hard to do if Botox is on board, until we wait till you get back to your baseline at 4 leaks a day, then we have to just get you down to 2, 1, or none. So it's, you don't have to wait till it totally wears off, but you definitely have to have symptoms so we can look for improvement of symptoms.
All right, we had someone ask, I am in my late 80s. How does that enter in for treatment?
Depends on your overall health. If you're on anticoagulation therapy, you know, there's the posterior tibial nerve stimulation is the least invasive. If you want to use that word, you just use like a little acupuncture needle in your posterior tibial nerve in your ankle. So you don't really need to be off blood thinners for that. You don't require general anesthesia. Bladder Botox, you cannot take blood thinners, aspirin, Motrin, vitamins a week ahead of time. The InterStim, you don't have to stop any blood thinners for the test, the 1 week test period. But after that, if we're putting in the implant, you'd have to be off the blood thinners and you'd have to be cleared by your doctors to be able to have general anesthesia.
All right, it's looking like that is going to wrap up our questions. I'll give it another minute or so if anyone wants to type them in. But I just want to reiterate too, that QR code is there, and Dr. Proctor is one of our Center of Excellence doctors who we are so grateful to get to work with and partner with, and he has treated a ton of the patients with this device, the InterStim device that Medtronic manufacturers. So it's a really great therapy. He's a wonderful physician, and we are very fortunate to be able to work with you. Please go ahead and scan that QR code if you would like to make an appointment. Like we said 100 times by now, that's the fastest way for you to schedule an appointment with him, is just scanning that and then putting webinar in when you're prompted for a reason for your visit. I know that a lot of what we covered is relevant to so many of you, especially based on the questions that were asked, but everyone is unique. So it can be very beneficial to make an appointment so you can discuss your individualized treatment plan with him. But thank you again, Dr. Proctor, for your time. We are so appreciative of working with you, and thank you for doing this with us. I think we're good on questions, so we'll go ahead and end this for everyone, and the recording will be sent out in an email to all of you.
Marianne, thank you very much for setting this up, and I appreciate everybody for joining this webinar. I truly do, and I look forward to meeting you in the future, hopefully.
Awesome. Thank you all. Have a good night.
Have a good night.